Folks, I got a couple things. One, sun is shining in Blue Ridge, Georgia. Beautiful Friday.
28 degrees.
That's okay.
Yeah, I know.
It's okay.
Ice on the windshield.
It's okay. I kindly like.
Little fog.
No, there's no fog.
No. There was at 6 o'clock.
I had said, wait a minute. One, nice sunny day at Blue Ridge, Georgia. Two, I'm at Circuit World. And three, world-renowned. They know you all the way around the world. I'm going to start. World-renowned Dr. William Whaley, right here in Blue Ridge, Georgia. How are you today?
Fine, and I feel lonely.
I don't know where that guy is. We're not going to talk about it.
Well, we got two guys. I mean,
Yes.
Justin was going to
be here.
with us.
We've met Justin.
He's been here before, and Justin is feeling bad this morning. And then Ray and his child bride are, on a yacht. I mean, he was sending pictures of the menu and this big meal and everything.
He just put him right out there. Just put him right out there.
He ain't working.
So now I can say...
He's not working, you could say.
No, I could say the other day, I don't know why, out of the clear blue sky, I got a text message saying it's 86 and breezy.
Yeah.
Well, come on, you really had to tell...
Well, but what he said was, it was a little chilly or something, and I said... What do you mean chilly? And that's what came back. 86 and breezy was chilly. Because he was wearing a long sleeve fancy shirt. Anyway, go up.
Dr. Raymond Tidman is enjoying life, and we're happy for him. We've got a couple questions here.
We got two really great questions this morning. I have been in practice. Well, see, I started medical school in 1962. So what's that? 59 years or something. Let's see, 60 years. This is the 60th year coming up I've been in medicine, and I have never seen what is in this first case. And I took this first case to two really top sports medicine guys. One of them was the president of the NFL Team Physician Society and the NHL Team Physician Society, and neither one had seen this particular event. We know of some other events that are sort of similar, but they're not. This guy is probably not one of a kind in the world. But we haven't found the other case. My brother is 65 years old and very muscular, and a very active man who is 35 years after treatment for testicular cancer with chemo. Remember, that's the Lance Armstrong cancer that chemo can cure, even if it's in your brain and everything. He has testosterone deficiency, which he would be expected to have because of the chemo, and they removed the testicle, right? When they had his original cancer. All right. With normal testosterone deficiency and is on a cream replacement with normal monitoring blood tests. He has an acute clot in his right subclavian vein that the hematologist has done scans and CT scans, and he has no recurrent cancer or masses. Now, they say that because frequently, when you have clots somewhere up in your chest, those are related to masses and things that are mashing on the veins. So why has this guy got a clot? That's what's there to get to this point, and there's not anything. All right. The hematologist says his clot was caused by very heavy weight work and exercises, causing an old, deformed, fractured clavicle on that side to compress the vein. And the exercise, probably with the compression, caused the clot. He was told to stop upper body exercise, and he is on Eliquis. That's the blood thinner.
Right.
Do you have any thoughts? Well, the first thought was, that's a strange case. But I got some really good thoughts. Throw that first one up there. So many men are on testosterone replacement therapy. Women don't get hormone therapy at age 50, and just about every woman's on hormone therapy. But men who've been treated for testicular cancer or colorectal cancer or anything else with chemo can be testicular deficient. Plus, about 35 to 50% of people by age 50 become testosterone deficient. So plenty of people are taking testosterone. So this first thing says blood clots and strokes and testosterone. So that's what you pull that down now. So that's been really well studied. And we know that testosterone administration to people does not increase their chances of getting testicular cancer, prostate cancer, which has been argued for a long time. So it's safe from that standpoint. But if you'll remember, those athletes, we talked about Lance Armstrong shots building up the red count, used to take testosterone to build up for the Olympics, right? And then they learned how to test for it. Okay, put the next one up there. Well, the reason they did that was it raised their red blood cell count, right? So your hematocrit would rise. Okay, you can pull that down. We're going to wait before we go up to this next one. You remember just a few weeks ago, we were talking about what does blood rheology mean? Rheology, remember that one? Flow characteristics.
Okay.
You remember that? So when
Not
blood
exactly.
gets a little thick.
You did tell me it would be on the test.
That's right. Blood gets a little thick. We used the analogy molasses or 30-weight oil in January. Remember, it's coming back now, right? Coming back. It's like college boards. If somewhere it said 30-weight oil, I'd be able to answer the question. Put the next one up there. So when your percentage of red blood goes above 47%, then the flow characteristics begin to get a little thicker. So it says, watch out for a hematocrit over 52. Well, that's 5 points above sort of the upper limit of normal. Okay, pull that down. So it did not say, but I guarantee you that this young man has probably, by whoever's giving him the testosterone, has had him donating blood every 6 months or something to keep the blood count down. If he hasn't, because that blood count was not mentioned in this question, but he's probably got an elevated blood count from 35 years of taking testosterone. All right, I won't give you your hand here. That one. You felt this before. That's a destroyed, busted up collarbone, right?
Yes, it is.
That's a mess, isn't it?
Yes, it is.
Okay, that ain't the way it's supposed to be, is it?
No, because
There's something wrong there, right?
Yes.
Okay, you're getting ready to see what's wrong because I got the same thing wrong this guy's got. All right, pick the next one up. All right, the clavicle. See, all right, the clavicle's just collarbone, that thing right there. It's in green on the TV screen. Pull that down. This is not my X-ray. And it's not his, but it might as well be. You see how that upper piece of busted clavicle is on top of that piece, and that's exactly what you were just feeling.
Right, yes, I could feel
My
that.
clavicle, when I had my wreck, and Ray Tidman put me in intensive care with a brain concussion because I hit on my shoulder first and blew out. I had my fracture was 7 pieces. This one's only 3 pieces. But you can see how that is malunioned right there, right? So it's not the right curve. So pull that up. This is, don't put the next one up now. So what that does is that clavicle is pushing down then on the vein that runs underneath the clavicle. So it's not a mass in the chest. It's not too tight of pants or something that gives you a clot in your leg, but this has been that way for 35 years, because that thing it's been there forever, but it didn't clot before. So what was the other part of that question that he told us about? Very heavy weight work and exercises. I called the person who wrote the question. This guy, who's 65, has been dating a younger woman, and he went to his health club for about a month on a big program of lifting weights, pushing the sled, and trying to get really buffed. And that heavy work created, you know how you get sore when you work. You might not know how you get sore when you work out. when you work out, you get so that was awful, wasn't it? So anyway, what he did there was
it's a distant memory.
Yeah, distant memories. He became with all that working out, he put some inflammatory process on that muscle around that vein, and that's all it took to slow down the flow. He probably also had an elevated red count, and so this is not a pathological process particularly. Eliquis is the right way to treat it.
Okay.
Now I want to show you something else here. I think I've told you once before that I learned how to stick a needle in the subclavian vein in Vietnam from a 19-year-old hospitalman who could do it in the dark in a helicopter. Show that next picture.
Wow.
Yeah, well, you see this needle here?
Yes.
Well, this is a modern day needle. In 1967, 1968, the needle that you had, if a guy had been shot, didn't have any peripheral veins because his blood's gone and you can't find a vein, you would stick underneath the subclavian because that thing's so big it doesn't collapse too badly. And you could get a needle in here and start giving fluids. That saved many people in bad trauma. So it was big done in Vietnam to casualties. So this 19-year-old Marine goes up, takes the guy's head, pulls it over here like that, goes right to the middle of the clavicle and takes the thing. It's about as big as an ice pick or bigger, and just stabs it up toward the corner of his neck there, and blood comes right out. So anyway, that's how you had to stick that needle in there. I learned that from a 19-year-old hospital corpsman, and I want to always say I love the military. I love the way these guys, they teach a 19-year-old how to do stuff that a doctor trained at Emory and Grady didn't know how to do. So I'm giving credit to them. So anyway, that's the vein. That's the exact location where this guy's was closed down by the fracture. Okay, pull that one down. What do you got to have before you can finish a question?
You got to have an algorithm.
Well, I'll be darned. There's the algorithm. All right, pull that thing up because you remember what we said. You've got provoked, remember that? And
right.
Unprovoked clots. So it's all we talk about. So people who've ridden a long time in coach in an airplane and get a pulmonary embolism,
yes.
That's provoked. Somebody who had a knee replacement got a clot, that's provoked. A woman who's taking birth control pills or had a pregnancy gets a clot, that's provoked. Now, you can pull that down now. You haven't been riding in an airplane, your pants may be a little tight or something, but if you got a clot in your leg, that's unprovoked.
I get it.
So, this guy didn't do any of the things that usually provoke it, but this is provoked by muscular exercise, not riding. See, we tell people when you ride in an airplane, you're going coast to coast or across the ocean coach to wiggle your feet every half an hour, or get up and walk once every hour to keep circulation going. And if you get here and you're going to drive all the way from here to Florida, stop every couple hours and walk, right?
Right.
So that's to keep you from having a clot. Well, this is the first time in my life I've ever heard of a clot in an upper extremity that was caused by exercise and a obstruction caused by a broken bone, and that sports medicine guy who treats millions of these, and they hardly ever are healed right, he'd never seen one either. So that's a real unusual case, and that's my thought. One, make sure his blood count's staying below 50 with his testosterone. Two, he needs to not try and work out quite so heavy and work up slowly, because it was that push that did it. And the algorithm says he should be on Eliquis for 3 months and then stop it. So he's doing right.
This question, you started out saying this is one that I had to go do some research on. I don't want to gloss over, and we don't talk about it that often. We talk about Georgia Cancer Specialists and Northside Cancer Center, but you guys are really into the research side. And you guys have really done some amazing work in research with cancer treatment.
It's a huge. That's actually what we're doing.
Right,
Because
exactly.
The research is so important to Northside Georgia Cancer, Emory, anybody else in this business, because this if you just watch the news, this business changes so fast. You talk about this vaccine for COVID is emergency use authorization. Almost every drug we use is on an emergency use authorization because the data that they get in early research isn't long enough to give final approval to the drug, but it seems to be like the Jimmy Carter drug that he took that got that cancer out of his brain, his lung, and his liver. That drug had just been released on an emergency use authorization because it was so effective. So that's important. That's why we worry so much about research. And then I don't think we see a patient that we don't go into our own protocol book, refresh the fact that, okay, I think I should give him this, but what has our group that treats breast cancer said about it in the last week? Because they meet every 4 weeks and then they update the protocol book. So yes, every patient we see is getting the modern best research information applied to their case.
All right. Now it's time for our second question.
It is, right?
Yeah.
Okay, second question. All right. This is a patient we already talked about.
I have to be careful here. I get to the point I can't find my glasses and they're on my head.
Had your head, all right.
Yeah, so.
My husband has just completed radiation therapy for prostate cancer that was left after radical prostatectomy. And a PET scan then showed nodes. Now, you remember this case? You discussed this case a few weeks ago. His insurance company had denied the PET before surgery. You remember this case? All right. And you had said that the scan probably would have shown the nodes. When we were doing that discussion, I said, they got to be doing some genetic testing on this tumor, which takes a little while. Remember? Now, they didn't put it in here, but he had a high Gleason score. Remember, 8 or 10. The oncologist had genetic tests done. So those tests were done after she had asked that previous question.
Right.
Now, what does this say? He has a BRCA gene positivity, and we have learned that his niece also had this gene. Now, who's the most famous person that's made that gene part of common conversation?
I'm not for sure. I don't know.
You are, because we showed her picture on here. Angelina Jolie.
Yeah, okay, all right.
Angelina Jolie has BRCA gene. What did she do? Let's talk about it. What'd she do? She had her breasts removed.
Right.
She had her ovaries removed.
Right.
To prevent a future cancer.
Right.
And when a beautiful woman like that had her breasts removed to prevent a future cancer, it's sort of like these alcoholic or depressed athletes who come out and say it's not bad to seek help. When Angelina Jolie can sacrifice her breasts and her ovaries to prevent cancer, it makes the average woman have a more accept that more easily, doesn't it?
Right.
Okay, so now we're talking about a gene, and his niece had her breast and her ovaries removed. So that niece probably felt better about it because of Angelina Jolie. Now, the oncologist is treating him with shots of Lupron and Casodex pills. Now, we said that was the right thing to do, didn't we, when he was here before? The PSA is falling. Well, we didn't know that before, did we? We just talked about the treatment. So that means that treatment is working. All right. He says that he should not take the BRCA drug. Well, we haven't mentioned the BRCA drug before, but there's a drug that is given to breast cancer patients if it recurs that have had the BRCA gene, because as you remember, a lot of our therapy now is gene directed and directed to specific targets. All right. Now, the oncologist says he should not take the BRCA drug unless he gets a relapse or metastatic disease. Now, listen to the next part of this. He also says there is no need to take off his testicles. Well, that's, but I saw on Dr. Google, I always tell patients, stay off of Dr. Google, that sometimes they do that with prostate cancer. What are your thoughts? Sometimes they take off the testicles with prostate cancer. Well, they take off the testicles with prostate cancer back when I was in medical school, because they knew that testosterone fed prostate cancer, and if it had spread, the only treatment that they had in those days was to remove the testicles first. If that worked, then that was fine. If not, then they could give them estrogens because they had no other medications. Well, now that hasn't been done in 30 years or 40 years because they have those drugs, the shots we're talking about.
Right.
So yes, they did take off testicles with prostate cancer, but that was 40 years ago or 50 years ago. So the guy's right. There's no indication to take that. All right, let's put up the next one, because this is kind of an interesting. We're going back over what we went over before about this patient. Okay, throw up the next one first. That would say what treatments are available. Okay, so remember, localized prostate cancer, there are a dozen things you can do. This clearly not an active surveillance candidate, because I'll come to it in a minute. We remembered he had a high Gleason score. And then you've got surgery, radiation therapy, targeted therapy. You can pull that down, hormonal therapy. This guy's gotten every daggum one of them except observation, and he's not a candidate for observation. So throw that next one up there. We always stage cancer, right? So we know from what they told us before that this cancer is in the lymph nodes. It's stage 3. There's only one more stage, and that's stage 4. That's always kind of bad, right?
Yes.
Okay, pull that one down. So that meant that it was that we learned from that question that when they asked it the first time was that there were some lymph nodes that they found were positive at the time of surgery that had been normal size on the CAT scan. The oncologist that he was seeing had suggested a PET scan. The insurance company denied it. They went in there to operate on him, and those normal sized lymph nodes had cancer in them. Remember that question? The way that happened? All right. So put up the next one. Remember that cancer, this is a Gleason score. Cancer can be really slow growing. That's Gleason's 5 or 6. And all of us in this room, assuming that we would possibly treat that by watching it, remember?
Right.
Now, when it gets up here in 8 and 10, see, that's a high grade. You can pull that down now. That's what this guy has. So there's no role for observation, and you got to go after it. And so next, what you got? Algorithm. Okay. Throw that up there. There's the algorithm. When you go down here, radiation, the guy had got it. Remember, we talked about that before, that if the PSA rises after these hormones, you can pull that down. Then the next step is radiation therapy. So now we haven't said a word about the BRCA, have we? We just established the fact that this guy is being treated appropriately. Okay, put the next one up there. This shows that 1 out of 8 women, about 1 out of 9 men get cancer of but women get cancer of the breast, men get cancer of the prostate. That the funding for research is much, much greater in the breast cancer than in the prostate cancer. Pull that down. Now, I've talked about that a number of times. Since the incidence of these two cancers are about equal, the number of deaths are about equal, why is more research done on breast cancer than on prostate cancer? Come on, guys, in the green room. Why is there more money spent on breast cancer research than prostate cancer research when the deaths per year are about equal?
Higher incidence of breast cancer.
What?
Higher incidence?
No, the incidence is the same. Yeah, women are, 1 in 8 and 1 in 9, what's the difference? Women are more squeaky wheel. They have put more, they are more squeaky, and they've put more pressure on the Congress. They've had more advocacy groups. They've had more marches on Washington. Men don't get together and march on Washington for their prostate cancer. They keep their mouth shut. So basically, it's disproportionate research that's probably related to politics. Okay, throw that next one up there. Here's a man right here, see him? He's got the BRCA gene. But we haven't talked about that because it's not Angelina Jolie, right?
Right.
Okay, so this is just about the genetics of it. You know, you can pull that down. But there's just as many men with a BRCA gene as there are women. There is no more BRCA gene positivity in women than there is in men. That's the way the story goes. So put up that next one. So if you look, we're going to spend a few minutes on this one here. There's two different BRCAs. So if you got BRCA1, you got a 50 to 65% chance as a woman of getting breast cancer. If it's BRCA2, it's 40 to 55. Well, those are both 50 plus or minus, right? You got that?
Yes.
Okay, that gene can give you a 1 to 3% chance or a 2 to 5% chance of getting pancreas cancer, which we never mentioned. But the ovary cancer is 40 to 85% in BRCA1 and 35 to 25% in BRCA2, and that's why BRCA women get their breasts and their ovaries removed after they've had their kids so that they aren't at risk for future cancers, because you can't screen for ovarian cancer. But what they've done is look down here at prostate. If you've got the BRCA2 mutation, that gives you a 15% chance of getting prostate cancer, and the BRCA1 gives you about a 10% chance, you can pull that down, of getting prostate cancer. And people never think about that. So nowadays, 100% of the prostate cancer patients that enter a medical oncologist's office get genetic counseling and get genetic testing. Amazing, huh? Well, when they asked that question the first time, that genetic testing had not been done, obviously. Well, now it's been done. So put up that next one. You don't really care about this, but there are lots of different mutations that can occur in a prostate cancer. So you see that? Now there's 1,000 little slices there, right? Well, the BRCA one is that 50
Yes.
or so. And so pull that thing down. So the BRCA gene is the most important gene driver. Most important gene driver of prostate cancer, although there are multiple other ones. Well, interestingly enough, BRCA is the only one we've got a treatment directed against. So throw up the next one. I'm not going to make you go through this, but this is all that biochemistry.
Yes.
What the BRCA1 gene does to stop cell division, increase cell death. You can pull that down. But the reason the question was, they said not to give it to him unless it recurs. Now, why would you not give the drug to him if he's got a high chance of recurrence rather than wait until it recurs? Now
I don't know. I mean,
the insurance company won't pay for it.
Well, that's what I was getting ready to say. I mean, it seems obvious that you should do it. Why would you wait? And the only reason I could think of is they went back and the insurance company said we're not paying for it. Well,
that's because the research that has been done
right.
was done on people that had metastatic disease. So it was released for metastatic disease. Now, there are programs ongoing, research, right, to test this hypothesis that giving this drug to people like this patient with Gleason 10 cancer who are sure to recur at some point, is it statistically beneficial? So there's research going on right now about giving it at this point. But at this point, there is no research to show that it's beneficial. Now, when that research shows that it's beneficial, you may get an emergency use authorization to begin using it. And the number of patients that will have had it will probably be 300 or 400. You've got to have thousands and longer term duration before you get a permanent approval for the drug. And I keep wanting to go back to that because people keep saying that the COVID vaccination's experimental. Well, heck, every one of our cancer therapies on a emergency use authorization is technically experimental. So that's the end of that.
Thank you, Georgia Cancer Specialist affiliated with Northside Cancer Center. We appreciate it. We want to thank Dr. Whaley for doing such in-depth research on the two questions each week. I watch other networks, and when they get into any kind of medical segments, it's just a real brief answer, no real explanations at all. You really take the time and research the questions that you have for the audience, and I can't say how much I appreciate that.
I appreciate that.
News of the day.
Whoa. We
Okay.
haven't gotten to the questions yet here.
What do we got?
How many deaths in Fannin County did you have last week?
104,
No.
106,
No.
114.
108.
All right,
How many you got this week?
108.
So the rate is 0 deaths per week this
Right.
week. All right, now the cases only went up by 4.
Okay.
Now that's just noise, right?
Right.
They were going up 100 and something a week about 6 weeks ago, right?
Yes.
Yeah. All right. Now, so we go over here to the test positivity number on our Georgia Department out there.
3.8 or something,
3.3. All right. Now, remember, way back when this whole thing started, Napoleon said, when you who's Napoleon? All right.
We're not going there right now.
The expert said, if you get below 5%, then you can open up. Things can open up. That was way back when, and that's when they called him Dr. Fauci instead of Napoleon. But this is now, remember, before July the 1st, it was...
There's a whole list of things they call him.
Okay, but
Moving
before
right along.
Before July the 1st, that was 1%.
Right.
Then after July the 4th, when that wave hit, it got up to 21%. And everybody was proper and being much more protective. It's 3% now. Now we go back and we watched Arkansas last week. It had 101. Tennessee had 101,000 people in the stadium.
And for the first 30 mints, 100,000 of them thought they would win.
Well, first 6 minutes.
Moving right along.
But 106 for the first 7 minutes, they thought they would. But anyway, they're just doing like this in each other's face. And this is what gets me. And then you see that they want to put a mask on a 6-year-old, and they want to give an immunization to a 6-year-old, and 101,000 people have been spitting each other's face for 4 hours on television. I mean, it just doesn't make any sense. So anyway, we're through with that. Now, news of the world. This is very important for North Georgia. I want you to read that out loud really slow.
What, with COVID-19?
Yeah.
Prevalent in deer? Experts urge precautions.
What percentage of deer in the United States are infected with the COVID vaccine?
I don't know.
Green room people, what's the number? What percentage of our deer in North Georgia, Pennsylvania?
3%.
What's the biggest state in the nation for deer hunting? Pennsylvania. All right. And more deer are killed by cars in Pennsylvania than by hunters, right?
This is true.
That? It's true. All right. Now, we're pretty high on the list of deer hunting, but so deer hunting is a big deal, right? So you say 3% this is affected. What percentage of deer are infected with COVID? 0% of deer that have been surveyed in the last 6 months have COVID. 80. So the non-Napoleon people are saying, if you're not vaccinated and you kill a deer, you should put on a mask and gloves to clean the deer. Now, I just have to tell you, I know a lot of guys, and one of my closest friends and your friends is out in Nebraska right now hunting for trophy deer. You don't think about trophy deer in Nebraska, do you? And I guarantee you, he ain't going to put on a mask or gloves when he starts cleaning that trophy deer. So I thought that was worth bringing up. it's deer season out there right now. For all of our, I'm sure the deer hunters are out in the field and their wives are watching this morning. So you tell your husband take his mask and gloves with him when he goes deer hunting.
All right, so I'm coming out of Ohio one night. It's somewhere around 1986. Just throw that, right? It's about 2 a.m. So, Pennsylvania.
You killed Bandit.
No. So I'm on Interstate 80, and if you ever crossed the Ohio line into Pennsylvania up there around Lake Erie, and you start out Interstate 80 up there, oh my God, in the fall.
That's
in the fall of the year. So
that's like Blue Ridge, so it's
I'm
country.
like, it's like 2 o'clock in the morning, and the traffic, I've never done this, the trucks, the big trucks are just creeping through there. They're not going, 100 mile an hour. They're just creeping. So I go in the first rest area, and I asked this, about 2 a.m, I asked this truck driver, I said, why is everybody moving so slow through here? He said, the deer. He said, this time of year, for so many weeks, they run across the interstate in herds, absolute herds. There's so many. Okay, so, and I mean, it was the first rest area in Pennsylvania. So I get back out, and it's a good 3-hour drive across the top of Pennsylvania. And I'm telling you, you would see on Interstate 80, about 2:30 in the morning, they would cross in herds, just massive herds of deer would cross. You said it. I know it has nothing to do with this segment.
I understand it, but I was going to say what that part says. It's like Blue Ridge, though. It's rural. It's gorgeous. It's got rolling hills.
No. You know what they say up there?
What?
Because if you hit a deer out there on Interstate, it tears the whole nose off the car.
It'll kill you.
And you know what the hunters say up there about they say our deer are just oversized rabbits.
Our deer are.
Yeah.
Oh, yeah, they are. But I wasn't saying the deer. I'm saying the ground, the countryside.
Because it's too warm here,
and the people up there.
And they
people up there have shotguns in the back of their pickups and flower rods in the back of their pickups, and they wear Carhartts. They're like the people who live here. And yes, their deer are bigger than ours.
What's that got to do with this program? COVID?
No, but the last two things on the air here before we go to work. What's this one say?
A little coffee may be healthy in pregnancy. Okay.
And what's that one say?
Pot use in pregnancy may harm the fetus. Okay,
all right.
I go with both of those.
You remember now, 50 years ago, I was the medical director of the largest narcotic treatment program in the world, and I wrote a paper on how marijuana had an adverse effect on fetal development, and that got blown out of the water. Not the fact that it did, but the publication of that got blown out of the water by these tree-hugging marijuana is a harmless drug and is not any worse than alcohol, because such a high proportion of adolescent and young adults are using and have used marijuana that it is public knowledge that when you get pregnant, many teenagers and adolescents will stop smoking because they know it's going to hurt that fetus.
Right.
Many teenagers and adolescents will stop drinking alcohol because they know, and it's been pounded into them since they were little bitty kids in first grade, that can have an adverse effect on the outcome of their pregnancy. But have you ever had anybody say that smoking pot during pregnancy can adversely affect the outcome of the pregnancy?
No, because you know what? And I know we have to get out here, but you know what? I don't say never, but it's never put up front for us to see research on marijuana smoking, cancer research on marijuana smoking. We had... we have research on cigarette smoking.
Yeah.
We got the warning on the pack. We've got so much money goes towards medical research. We did all that with the tobacco industry. Now, marijuana is the next tobacco industry.
Yeah.
Okay?
Yeah.
And you don't see it out in front of you. Are we going to see in 20 years research out there on...
Okay, we already know it causes chronic lung disease much worse than cigarettes, but we don't know and don't have enough numbers to know what its cancer causing predictions.
I don't know that pulling any smoke into your lung is okay.
No, that's why I think the gummy bear marijuana industry probably.
Buy the gummy bear marijuana.
Oh, and the low calorie gummy bear, the no sugar added. That's enough to stop with right there, don't you think?
Yeah, and the brownies at the party.
I don't think that Georgia Cancer is not recommending that you buy.
No. Now I want to say this, and then we got to get you to work because you always have to go to work. I'm trying really hard to pay attention, but we're at Circuit World, and he's got these monster clear TVs, and I keep thinking one of these football players is going to run me over, or they're throwing the ball at me. You can't see it.
It's huge.
Yes.
Yeah, but you notice
he's got it on Sports Channel, and the football players, I'm thinking I'm going to get hit with one of these footballs, or somebody's going to run me over.
Well, during the break, while we took that 3-minute break after your rant and rave before this calm program began, they showed Falcons, and Matt Ryan spent the night last night lying on his back. And the Falcons scored 0 points last night up in Atlanta, but they were playing the Patriots. So Patriots came down to Atlanta's backyard, and they scored 0 points. Now, how many points did they score last weekend?
I don't know. I don't watch Falcons.
3. I don't think a professional football team that scores 3 points in 2 weeks has got much of an excuse. Do you?
You have to go to work. I got to deal with Bruce. Bruce, I don't know exactly what he's saying, but he's making these little comments over there, and I got to check in.
One more thing. High school football.
Yes, tonight.
High school football. Fannin is playing Fitzgerald.
Yes.
That's down. Now, they come from South Georgia. Now, you remember last time they played Fitzgerald, they thought they were playing a college team because those boys down there are coming off the farm. And the Fannin guys said, is that a private school and do they recruit kids? They said, no, they just got a bunch of farmers down here.
But
so that ought to be a good
Fitzgerald is set to play. Fannin is set to play. Just because you said it, we'll throw it out there. This is a rematch.
Yeah, 7 o'clock tonight.
Fannin wants them back here tonight. You got to get to work. We got to get out. It's time for.
Wait a minute. What's important?
Now what?
High school football. This is the South.
Yes, it is.
Let's go to break. Will you?
Yeah, take a break. We'll be right back.